Scapular adduction is assessed with the patient prone and their shoulder at the edge of the table. The shoulder is abducted to 90 degrees and the elbow is flexed to a right angle or can remain extended. The head may be turned to either side for comfort. There are two ways to give resistance to the scapular adductors. The decision as to which technique to use depends on the strength of the posterior deltoid. When the posterior deltoid is grade 3 or better, then downward resistance is given over the distal end of the humerus. The therapist should stabilize the contralateral scapular area to prevent trunk rotation. When the posterior deltoid is grade 2 or less, then downward resistance is given over the shoulder joint. This more proximal placement of resistance requires less scapular adductor muscle strength by the patient than is needed in the test previously described. The therapist still needs to stabilize the contralateral scapular area to prevent trunk rotation.
Lift your elbow towards the ceiling. Hold it. Don't let me push it down. Relax.
When assessing scapular adduction for grades 2 and below, the starting position is similar, except that the therapist cradles the patient's shoulder and arm, thus supporting its weight. The middle fibers of the trapezius are palpated as the patient attempts to horizontally abduct the arm and adduct their scapula.
Try to lift your elbow toward the ceiling.